Hello everybody, my name is Michael and I'm here to start a series of videos. This series of videos that I'm starting here today is going to help out everybody out there, especially those people who are involved in the medical field. People who are within the medical field, this is the right place for you because you'll be able to make a recap of everything that you need to know. It's actually a summary of some of the topics that are being discussed in medicine. So today is going to be my first video for today, but I will continue with your support. I will be able to continue if I see your feedback. If you are able to respond, I will be able to continue with a lot of videos that are going to be so helpful in your medical career and your research. So today, the first thing that I'm going to discuss with you today is scrotal swelling. What is scrotal swelling? The first thing that we are supposed to know, if we are to find out about scrotal swelling, we should know the anatomy of the scrotum. We know that the anatomy of the scrotum is something that is very important when it comes to making a diagnosis of a scrotal swelling. The outer part of the scrotum, we have the scrotal skin. Going inwards, when we cut the scrotal skin, the first layer that we find is going to be the superficial scrotal fascia. After cutting through the superficial scrotal fascia, we are going to find the external spermatic fascia. After cutting through this external spermatic fascia, we are going to find the cremasteric muscle and fascia. Going deep more inside, we cut and we are going to find the internal spermatic fascia. After the internal spermatic fascia, we'll be able to find the parietal layer of the tunica vaginalis. After finding the parietal layer of the tunica vaginalis, then we can simply acquire the epididymis. Seeing the epididymis, the last layer, of course, that is the testis itself. So talking about scrotal swelling, what is scrotal swelling? How can we differentiate? Because scrotal swelling, a patient would present with a scrotal swelling, but we have to know what really is the problem. There are different types and different causes of scrotal swelling. It may be a hydrocele, it may be a varicocele, it may be a spermatocele, hematocele, epididymocyst, epididymoorchitis, testicular tumor, a lot of causes of scrotal swelling. So as a good doctor, you are supposed to know which one is the swelling that has brought this patient to this hospital. So there are a lot of things that we need to know. First, we need to do tests, physical examination. Under the physical examination, we need to rule out hernia. Because sometimes we know that a testicle is coming from the abdomen during the early stages of development. They descend, and there are some instances where we have undescended testes. So when the testis is coming from the abdomen, there's still that connection between the scrotum and the abdomen. So in people who have some certain developmental anomalies, you may find that there would be hernia that is coming from the peritoneum going down to the scrotum. So we need to differentiate between different types of scrotal swelling. So the first test that we are going to do, we are going to perform a get above swelling test. This is when you are able to palpate the root of the scrotum. Try to find the origin of the swelling. If you are able to find the origin of the swelling, that means the get above the swelling test is positive, meaning the swelling is only confined to the scrotum. But if you try to palpate the root of the scrotum and trying to look for the origin of the swelling, and you cannot find that origin, it means we are dealing with something that is coming from the peritoneum. It could be an inguinal hernia or anything, but the swelling is not confined to the scrotum. The next test that we would do is a transillumination test. A patient is presented with a scrotal swelling. You need to be in a dark room to perform a transillumination test. This test is a test that we use a torch or a light. Put a light on the scrotum. If this is a scrotum, just put a light on the scrotum. If you see the scrotum is glowing, you have to be in a dark room. If it glows, that shows a positive transillumination test, indicating that the swelling is cystic and it is not solid. The other things that we do, there are a lot of tests that we do, but for now we are going to discuss only two. So, what next if we do this? We can classify scrotal swelling according to the location. Like I said earlier, it can be confined to the scrotum, or it can be above the scrotum, maybe outside the scrotum. So if something is outside the scrotum, that means we are dealing with an inguinal hernia. It can be an encysted hydrocele of the spermatic cord, or it can be a varicocele. But if it is confined within the scrotum, that is so easy for us to treat. We should know that it could be anything in the scrotum, in the problems of the scrotum, epididymis, epididymocyst. So we need to differentiate according to location, and we can also differentiate or classify according to the pain. There are some painful swellings and painless swellings. Painful swellings are usually acute, and painless swellings are chronic. So I'm going to talk about the painful swellings first. The painful swellings would be, the first one is trauma. Someone is involved in an accident, or someone slips and falls down and hits their testicles. That is trauma. That is so painful. The second one is testicular torsion. Twisting of the spermatic cord allows the strangulation of blood flow to the testis, which leads to testicular ischemia, which results in pain. The other one would be acute epididymoorchitis. This is a condition that is mostly caused by chlamydia infections or gonococcal infections. It is an inflammation of the epididymis, and where there is inflammation, there is pain. The painless ones would be testicular tumor. It is usually painless.